Trauma is a lasting bodily response in relation to a variety of psychological, biological, social, and other environmental factors. It is the brain's protective mechanism from uncontrollable, terrifying life events wherein the individual did not feel safe. An embedded trauma response can manifest as fight, flee, or freeze, or as some combination of constriction, pain, fear, dread, anxiety, and unpleasantness. A traumatic response does not involve the rational brain. Trying to deal with trauma just in the head can lead to narratives that block rather than help us access the trauma. In order to bypass these stories and access the true emotions behind the trauma, one must work directly with the body. This can be done through therapy that uses the body, which is exactly what drama therapy does.
In a therapy group of women who have trauma in their bodies from sexual assault, improvisational drama therapy can help to express and transform these traumatic responses. Group members hold space for each other's experiences, and witnessing others, they can recognize parts of themselves. In a study using improvisation and role play with adolescent girls who had experienced sexual trauma, McKay reported a reduced intensity in psychological symptoms such as depression. The participants also reported feeling less alone and validated in their feelings. These techniques can be as simple as free movement or can involve images and role play.
I feel nothing.
Where is the nothingness in your body?
Everywhere, I guess. Like it feels empty and heavy at the same time. It paralyzes me.
It paralyzes you. In encouraging free expression and movement with the body, one can change their relationship to their body by developing empathy and compassion for it. The work begins with noticing what is happening within us. Once these feelings are recognized, they can be explored and transformed.
Image theater, developed by activist and theater practitioner Augusto Boal, uses still images to explore unconscious thoughts and forces of oppression. Trauma involves many complex and even conflicting emotional responses, and by visually perceiving, embodying, and interacting with these emotions, we can understand them better. For example, some survivors may experience shame and guilt, but also anger. Participants' bodies become silent sculptures. There are no lines to learn or acting skills involved. It is all improvised and based on feeling, not performance. These images can then be personified and brought to life. If your sculptures had to say something, what would they say?
It's my fault. It is not your fault.
Great. Keep repeating this and let your bodies move if they need to.
It's my fault. It is not your fault.
It's my fault.
It is not your fault.
It's my fault.
It is not your fault.
What if you were to respond differently?
Why not? It had nothing to do with anything you did.
I feel like I made it happen somehow. If it weren't for me, it would never have happened.
Don't blame yourself, blame them.
Image theater allows group members to pause in the here and now. This is especially important with freeze responses to trauma, as it could re-establish their relationship to stillness, using it as a way to connect rather than hide from themselves. Images can also be used to help members envision what the healing process might look like.
What might it look like if compassion for yourself entered the picture?
I'm doing what I can with what was put on me.
I am gentle with myself.
I'm moving forwards.
By transforming the image of what currently is into what we want it to be, we can explore the space in between and begin to envision healing. Image theater is an opportunity for this betweenness to be a space where survivors can connect with and explore their bodies authentically, vulnerably, and safely. In doing so, clients are able to transform and change the narratives of their trauma from that of helplessness, pain, and shame to empowerment, strength, and compassion.